Hello and welcome back to my channel. If you're just stumbling on my video for the very first time, my name is Dorothy Shitanga and I am a pharmacist living and practicing in Nigeria. Please ignore this face. I recently moved into town and I'm just trying to adjust to the new whole environment and all, and that's why you might be seeing my face looking like this, like I've not slept. But then the content still has to keep growing. So today's episode of Pharma Talk, I want to talk about treating infections. So a lot of people walk into the pharmacy and they are telling you, I get infection, I won't treat infection. Mind you, a lot of infections might present in the same way. They might be telling you is itching, which means anytime you are having any itching, it could be fungal. Now, fungal infection. It is not every bacterial or fungal that usually present themselves as itching. There are other parasites that can also infect you and then you will itch. For instance, scabies. When people get infected with scabies, they tend to have lots of itching. And a lot of persons will take antibiotic, antifungal, and it will not work. Why? Because you need to be able to identify the exact cause, and that way you'll be able to treat properly. First of all, before you treat any infection, you need to know exactly what organism is causing that infection. So you might say you are having itching as a lady, or you are having itching as a guy, and then you just feel like it's an infection. Yes, let's say it's an infection. What organism is causing that infection? You need to know, and that is why it's important you run certain tests. And some of the tests that you can run to know the kind of organism that is causing your infection, you can do a blood culture test, you can do a urine culture and sensitivity test. For ladies, you can do the high vaginal swab test, and for the guys, you can do the urethral swab test. These are tests that will help you culture and see exactly what organism is causing that infection, and then you can now treat properly. During the course of the test, a sensitivity is done to know exactly what antibiotic is necessary in treating that particular organism. So don't just say I want to treat infection and then you go to the pharmacy, you want to buy Ampiclox because you feel like, let me burst your bubble. Ampiclox and all of these other medications, they might not be sensitive to the exact organism. And I see a lot of you coming to say, oh, that Ampiclox na fake, or that Ampiclox no be original one. It's not really because it wasn't an original one, or it was a counterfeit, but then it's because there is a possibility that that organism or the bacteria that is causing that particular infection is not sensitive, that is, it is not responding to Ampiclox, and therefore if you use Ampiclox, it would not work. So before you say you want to treat any infection, make sure you speak to a professional, speak to a pharmacist, speak to your doctor, or you go to the lab, tell them you want to run a test for infection. Then they can now tell you, okay, this is what to do, this is what not to do, these are the tests you will do, and the rest. So I want to believe that this video was helpful in its little way. If there are other questions you want me to address when it comes to treating infections and the rest, please feel free to drop them in the comment section, and I promise to make a video to answer all of those questions. Until I come your way next week, to take care of yourselves, and bye.